Well, one thing we know, and you're going to know this better than me, is that PMDD, premenstrual dysphoric disorder, one of the manifestations of that compared to sort of traditional depressive presentations is anger and mood lability, right? So if you have somebody who might maybe have some narcissistic qualities, during those periods, that sort of that late luteal phase, you're right before a person's menstrual cycle, that lability, that seeming like sort of irritability can really flare up and present as a narcissism, an abruptness, I can't be bothered with you, why don't you just shut up, that kind of thing. It'd be that sort of dismissive. And people around that person, I mean, listen, we know what the stereotype is of a woman who's on her period, right? But I think that some of that is an irritable presentation of the depressive symptomatology that's shorter term, right? It's linked to the menstrual cycle. So I think we definitely can see that. And as we know that, as you know better again than I do, that the hormonal fluctuations are a big marker for why women have higher rates of depression than men. If we were to lift that out, there'd probably be a little bit more equalization, and that women have these fluctuations from menarche, from the onset of menses, all the way through to post-menopause, right? So that's a long period of our lives where these hormonal fluctuations will come up. And some of that really does show up as irritability. And then when you throw into the mix the social piece that women aren't supposed to be irritable, we're supposed to be nice and friendly and warm and caregiving, then there's going to be more focus on an irritable woman and a quicker likelihood to say, what a B word, and then sort of tracking that to narcissism.
Yeah, you're right. It's a catch-22. We want to have support during these hormonal fluctuations, but we don't want to be, blamed and shamed because of them.